The advice and opinions expressed by Dr. Grant-Pichet and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Grant-Pichet is
Dr. Doreen is an expert in autism.
Doreen Grant-Pichet.
Dr. Grant-Pichet.
Dr. Doreen Grant-Pichet.
Dr. Doreen Grant-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Well, Kylie has written in and said, "Hi, Shannon. Hi, Dr. Doreen. My friend and I always talk about our daughters on the spectrum who both have GI issues.
Yep.
One thing we struggle with is that our daughters can't tell us how they are.
Yeah.
And that's, I'm sending you a hug because that's part of the issue, right?
Yeah, it really is. It's very, very difficult. And I had a parent who, those, when you go to the ER, they have a set of pictures that are on the wall that are like 6 pictures of starting with a very smiley face to a very upset face. Yeah, and they ask you how severe is your pain, and you have to kind of pick one of those.
Yeah.
So I had a parent who used to work in an ER, I think, and actually had used that picture to get their child just on different days to point to how they felt.
Yeah.
And that is a really brilliant idea if you think about it. They don't have to tell you exactly what's going on. I mean, it would be nice if they could. Most kids can't.
Right.
But if they could tell you how they feel, and then if you have done, a comprehensive blood panel, let's say, or you have their stool analyzed, etc. And now okay, I have a child. Like I know with my kids, I have one child who has GI issues, and she has actually she has celiac. So she must be on a gluten-free diet, right?
Yeah.
So it's important to find that out and do the best you can with it. And because the better they feel, the more they learn.
Yeah, absolutely. Their thing got chopped off. So she went on to say, we struggle with is that our daughters can't tell us how they are physically feeling. Are there any procedures to teach kids to tell us if something hurts? My little one is almost 6 and not using many words. So starting with that.
Yeah, because you can't teach them to tell you when something physically hurts, but you can teach a child to identify, to match the way they feel that day to a picture. Okay. So it's not about, my tummy is causing me pain today. It's more about, today I feel like that.
Right.
And then another day, today I feel like that. And if you do that over the course of time, every day, and you can teach that because you can see when your child is grumpy, teach them to touch the one that is unhappy.
Yeah.
And you don't have to have 6. You can have just 2.
Right.
Or 3, a neutral one, a positive one, and a negative one. And when they're happy, teach them to touch the happy. And what you're doing is you're just matching. And it's a simple concept and the child will get it. And from there on, at least they can communicate with you if they feel the upset one or the happy one, or if they're just neutral.
Absolutely. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.